Hello, I'm Tara Brabazon, and I'm the Dean of Graduate Research at Flinders University. And welcome to vlog 298, Personal and Academic Bravery. Now, bravery is one of those words. It has a bit of an ambivalent history. I always sort of laugh and get a bit horrified about the word bravery when I think about the British program, Yes Minister. Some of you may remember it. There was sort of Jim Hacker, who was this mediocre politician, and he had this rather posh chief administrator, private secretary. What was his name? Was it Sir Humphrey? And whenever Jim used to say, oh, that's a brave decision, that used to be code for it was going to cost him votes, right? And then, of course, when he said, that's a courageous decision, then Sir Humphrey sort of meant you're about to lose the election. So the word bravery is a little bit ambivalent, and I want to get rid of that ambivalence today. I want to introduce you to somebody who will change your life. Your life will be changed in the next 30 minutes. If you need inspiration, if you need, why am I doing this? How do we think our way out of this pandemic? How do we create a better future? You are about to meet somebody astounding. Fariba is a transformative human. She has changed my life. I am so glad that this incredible woman, has come into my path, and we're going to talk about this. I get to share her with you today. Now, she's an outstanding gynecologist. Now, that in of itself is remarkable and powerful and is incredibly important, and we'll be talking about that as well. But she's so much more than that. She's an advocate for women's health, has specialisms particularly in pelvic floor medicine, reconstructive surgery, and what's often called minimally invasive surgery, a world leader in that. She's the founder of FBW Gynecology Plus in Adelaide, but that's not all. She's also the founder of, don't get upset, Tara, Desert Flower Australia, supporting victims of female genital mutilation. This incredible person has just completed her PhD at Flinders University. In fact, she was confirmed 2 days ago. So it's time to see bravery and learn from bravery. Hi, Fariba.
Hi, thank you, Tara, for such a kind introduction. I am not that, but you're very kind.
You are that, and you are so much more than that. And let's just start with the first question, which will prove it to everybody.
Okay.
Now, you have this incredible personal journey, professional journey, and academic journey, and they're all sort of linked. But these incredible stories actually emerged and started before you even came to Australia, let alone before you entered a PhD program. So you actually have the most incredible life that I've ever heard about. Could you tell us a little bit about those journeys before you even came to Australia?
I grew up, I was born in Iran, and I grew up in a family where charity and education was very important. My father was a very prominent person, and he ran an orphanage for women to empower women. And he always believed that if you want to rescue a society or prevent a society from being ruined, you should prevent women from being in poverty and illiterate. So literacy and having money, economically being well off, would rescue any society. So it was started with women, and it would finish with women. So he was very woman-centered. So he said, if you want to get rid of prostitution, give the woman a job. If you want the children to be educated, educate the woman, because that is the first point of contact. And he had 4 girls and 2 sons, but we were all equally treated. And that is not something that is common in Middle East. So women are a little bit of second-class citizens. But for my dad, everybody was the same in terms of children. And when I was about 10 years old, he went through a very life-challenging, life-threatening challenge. And I remember that my mom on that day was praying, begging, fighting with God, I don't know. And she expressed how helpless she was, looking after 6 children while he is going through those life-threatening challenges. And I promised myself there and then, and that changed my life, that I never will be in the situation that my mother is. I will be educated, I will have my own money, I will be independent, so that I'm not relying on another person to take care of me and take care of my children. And I couldn't study medicine in Iran because of the circumstances that we had. So I had to leave and go to Germany to study. And then I fell in love and I came to Australia and I did my specialty in Australia. And all of that sacrifice, you know, you leave your loved one behind and you lose people that you have loved in war and revolution. So you have to leave a legacy behind to make all that worthwhile. So, and that's why I was so interested in education, and that's why the journey that I had to have.
And, you know, you've so often, time and time again, you've arrived in a new nation, had to learn a new language, commit to education and go again. It's an astonishing story.
Yes, when you're determined, you do it. When you have to do it, you somehow find ways to do it. But I really thought there is, during the war and revolution, which happened when I was 10 years old, you realize that the caring for humanity is paramount. So there is nothing else that can replace that. And we noticed that during the COVID as well. No money, no status, nothing helped people but the care for humanity. So I am always privileged to be a care provider to the society wherever I am.
You are remarkable. Do you see, for the wonderful people watching this vlog, why we are so privileged that Fariba chose to study with us, and how incredibly privileged we are in Australia to have her as a citizen of this nation. It is a profoundly moving story, and it humbles me, as it should humble, I think, all of us. But you've already talked about when you've moved those nations multiple times and you started to change your specialisms. Now, why gynecology? Because, you know, you're so brilliant, you could have gone into any specialism. Why did you choose that particular one?
I think there were 2 things that influenced my decision. One was when I was a child, I noticed that my mother would go to bathroom frequently, and each time she would take one of us. She had 6 children, so she could pretend that the children needed to go to the bathroom. And we would stand there until she would finish whatever she had to finish and come back. And I realized that it was embarrassing for her to even tell my dad or my grandmother that she had urinary problem. And it really, I felt for her, and I was happy always to put my hands up and go with her to toilet so she would blame it on me. And when I went to Germany, I realized that women don't offer those kind of information to other women either, or don't discuss it with the doctors, and women's health issues were sort of a taboo subject. Sexuality is certainly a taboo subject. And it felt that women lost their value after they had children. Everybody is happy to talk about our pregnancy, baby showers, celebration, but the consequences of those pregnancies and the consequences of giving birth, nobody talked about it, and it became a taboo subject. And usually it is a part of being a mother, it's a part of being a woman, and you should put up with it. And then I came to Australia, and that was the same story in Australia. So that, and we are talking about 20, 25 years ago. And that was the same subject and the same problem, that nobody would talk about that. And it was always a hush hush when it came to women. If it was a prostate problem, everybody knew about it. But if it was something to do with women's health, you know, it's not good to talk about it. So I've sort of felt women need a voice, but I wasn't quite ready to get into gynecology and so on. Until when I came to Australia, I felt pregnant, and that was an unplanned pregnancy with my beautiful daughter, Nadia. And I considered termination. And I went and the doctor asked me, why did I want a termination? I said, look, I just have arrived in Australia. I don't have any friends. I don't have any family. And my husband is doing PhD, minimal wages. I don't have a job. And to top it off, I don't have any private cover. And he, Dr. Cohen, he said, Nana, that's okay. I'll look after you. He treated me like a private patient. He said, I will support you, keep your pregnancy. And he gave me the best care that I ever could have dreamed of. And I thought, I want to be him,
Wow.
but represent those women who are ashamed or embarrassed to talk about their condition. And these two things basically gave me my calling to become a gynecologist.
Isn't that amazing? And of course, we have that cliche of paying it forward, but your life has captured that to the nth degree. It's just stunning. And you're leading me into my next question, which I've been quite obsessed since I've met you. I've been quite obsessed by the phrase you use a great deal, which is, quote, a woman-centered approach to care. Now, I love that phrase. Can you put a bit of flesh on that bone? What does that mean for you and your practice?
Sure. Women-centered approach is considering the woman as whole rather than a condition. So considering her physical, emotional, social, economical aspect. For example, let's take an example, heavy periods.
Yes.
It's straight away, 30 years ago, a lot of doctors would have offered hysterectomy. Let's get rid of the bleeding. But hysterectomy is a major operation. It can have significant complication. It needs 6 weeks of recovery. Some women are single mothers. Some women have a lot of duties, important roles in whatever they do. They don't have 6 weeks to take off.
Wow.
And women are used to have periods. We just want manageable periods. So why don't we reduce the heaviness, the amount of the bleeding by less invasive procedures and give that kind of quality of life back to her so she can function socially, emotionally, in terms of intimacy and in terms of her normal work. Or women with pelvic pain and endometriosis, sometimes they have been offered to have hysterectomy, but they haven't finished their family. Some women are happy to have a little bit of pelvic pain, but preserve their fertility. So it is giving the service according to the woman's need rather than what we can do and what we perceive as the correct approach.
That is profound for me. So there is, I suppose, that's part of the arc of women's health, women's medicine, women's bodies, is that a Fordist response, so when in doubt, hysterectomy, a Fordist response was endlessly offered. And what your incredible practice is doing, and your research, which we'll talk about in a second, what your research is suggesting is women are diverse in life and in hopes and pasts and futures. And why isn't our care for women as diverse as their lives are?
Exactly. But having said that, Tara, things have changed over the last 30 years. So now we are all moving towards a minimally invasive surgeries. But now we have to take it even to the next level of minimally invasiveness in anything that we do.
That's fantastic. And of course, that therefore leads to your research. And this is the gift of having met you at Flinders University, because so many leading specialists in their field, of which you are clearly in this country, so many leading specialists in their field, because they are so frantically busy, and just fitting into your schedule is incredibly challenging because your services are under such demand. But you've continued to research during your time as a specialist, which is incredibly rare. Why did you make that decision, Fariba?
In Iran, where I come from, being a specialist, you have university appointment. You work at the hospital that are connected to university, and you have private practice. And as you are expected to do research when you are affiliated with the university, because you are training other specialties, you are training medical students and so on. And when I went to Europe, it was the same. So UK or Germany, research is a part of the part of life. In Australia, less. However, having said that, it is changing. It is changing now.
It is changing.
Yes, definitely. But not back then when I came to Australia. There were a few people who were prominent in their fields and would do research. And I was lucky to be working with them. People like Professor Thierry Van Carly or the Professor Jason Abbott. And in Adelaide, my mentors and supervisors, Professor O'Shea and Professor Shaman. They were training us as a trainee in surgical skills, but they were expecting us to do research as well. So for me, it's a charity and an act of charity that I do continue with research in my private practice, because I want to tell the patient how good this procedure is in my hand rather than in the literature. It in my hand might not be as good as in the literature, or in my hand might be better than in the literature.
Indeed.
And then the patient can choose and be consented better in terms of, informed consent. And then she can decide if she wants to be with me, so with somebody else, or if that is the approach that she want to take. And yeah.
I was going to say that is absolutely profound. And so it is about, again, woman-centered care as well. So here are the options. This is what the research suggests. This is what my research suggests.
Yeah.
And then empowering the woman to make decisions that are suitable for her life and career.
However, my regenerative work was based on a challenge that I have faced in my career. So it's nothing to do with my previous mentors. I was challenged by a 30-year-old woman who had breast cancer, who had gone through breast surgery, removal of both breasts, chemotherapy. The husband couldn't support her through the surgery and left her. And then because of chemotherapy and the medication that they take afterwards, she had very painful and tender vulva.
Oh.
She couldn't even sit down. During this time, she had met this man who loved her and cared for her and wanted to be a part of her journey, but she couldn't be intimate with him. She had seen 8 gynecologists before she saw me. And she said to me that if you don't help me, I will kill myself. Everybody says the only person who can help you is Fariba. And I didn't know why my colleague would have said that, because I didn't have anything to offer either.
Oh, wow.
And because she said that she might kill herself, I lied to Tara. I said, I will help you. Just give me a little bit of time. I needed to think.
Yes.
And come up with something for this poor woman. I have a daughter myself as well. So I really felt bad for her. And on the same day, I was invited to a vampire face party. And I said, oh, no, I can't do this. And they said, now come, it will be fun. I went to this vampire facelift party, and they used PRP to rejuvenate their skin. So this professor had injected half of the skin with the PRP and not the other half. And I thought, this is what this woman needs in the vagina, something that is non-hormonal, something that is non-surgical, and maybe regenerates the tissue. And I told her, look, I have no background to this. I have no research. This is not harmful. I know that's not harmful because it is from your own body, but it may help. And we injected her, and I said, you need 3 treatments. A month later, when she came, she said, doctor, can you keep half of that golden fluid and put it in my face, because I feel I have a bit of wrinkles as well. And I knew that she had good outcome, and she became sexually active. She got married. She then moved to America, and she was a Christian lady who sang Christian songs. And then she basically gave me one of her CDs after she recorded her CD. And that gave me the idea of there is more research to be done. I am a good surgeon, but my good surgical skills are not going to help every woman. And I decided to do a research. I went to the ethics committee, got the ethic approval, wrote to 100 GPs to send me this kind of patients. And you cannot believe it, that 55 of those people who came to see me were doctors or doctors' wives. And that is when I knew that this area needs exploration. And what I have done is really the tip of the iceberg. There is so much to be done, and there's so much work to be done. And I'm hoping that the next generation will take it to the next level.
Oh, Fariba, it is just, what a profound story. I mean, I'm tearing up here. I'm getting all messed up. But the idea, I mean, that's also the synergetic nature of research, isn't it? It's like a problem is presented and we're desperate to provide a solution. So, you know, the old cliche about research is, what problem are you solving? And I think you've captured that brilliantly there, which of course leads to my next question and how you and I met, which was one of the great privileges of my life, where for some reason, the wonderful colleagues watching this vlog, this incredible human appeared in my office. You sat just where that chair is now, Fariba, and this remarkable human came into my office early one morning and said, look, I'm thinking of doing a PhD, particularly the PhD by prior publication. Wow. I mean, wow, can you imagine? What a privilege. And Fariba, therefore, my first question is, why did you decide at this point, with all your expertise and international fame and all the rest of it, why did you decide that at this point a PhD by prior publication was for you?
Tara, it was truly the pleasure to meet you, because I couldn't find any supervisors, and you really listened to me and you guided me how I could do this. I have a philosophical mindset and for women's health, and I am able to think laterally and come up with some solution.
Yes.
I have done a master in minimally invasive surgery, and I am a doctor of medicine, or
yes,
by whatever we have done so far. A PhD is a doctor of philosophy, so it builds on past, takes the present, and has a futuristic approach. And that is what I wanted to do the PhD. And the PhD allows us to push the boundaries and tell a story that is behind our work. And in my case, it was starting with minimally invasive surgery, but really promoting the philosophy of being non-invasive. It's possible in women's health, and using regenerative medicine to achieve it.
Oh, it look incredible. And we're going to talk about your experience of having done it and how you feel about it now that it's over and you've been so successful and the examiner's results were so remarkable. I just wanted to, as I'm about to talk about your experience of doing the PPP, log that your examiners loved your innovation. So I thought it was remarkable. We had a remarkable examiner from Imperial College in the United Kingdom who logged, because obviously you have a contextual statement and then the remarkable publications you've done. And this colleague from Imperial logged the profound innovation of your contextual statement and the personal and the professional and the academic and the scientific narratives that came together so beautifully in that document. So the examiner's results were just remarkable, and it was a very, very quick examination. So therefore, you entered this program with motivation and desire and hope. So what was your experience of doing the PPP? Noting, I should say, Fariba, that Fariba was our first female to do a PPP at Flinders University, and she was also the fastest PhD completion in the history of Flinders University. So surprise. So Fariba, what was your experience of doing this qualification?
I had difficulties finding supervisors because my area of research is still controversial for many of my colleagues. But the initial disappointing setback was something like divine intervention, as it allowed me to work with you and Cameron. So it was the amazing sacrifice of you that you gave me every Sunday that absolutely motivated me, that somebody is sitting at her desk every Sunday expecting a chapter or something. So I took off my clinical work. I reduced my clinical work, I put stop of my personal life, social life, so nobody could see me. And I am going to do this within 16 months because I have amazing supervisors such as you and Cameron. And you made me fly through PhD within 3 to 4 months because simply I knew I have to deliver every Saturday evening. And there was no ifs and buts. And I think I missed on one Sunday.
Only once. Only once.
Because it was so much that I couldn't work, operate, and address the changes that were required. But I want to really say this, that you truly put the word super in supervisor.
Oh.
And I think yes, I am determined, I am hardworking.
You are. You are powerful.
On the other side, I had the most determined supervisors as well. And that combination helped me to finish the PhD within 3 to 4 months.
Oh, and look, it was one of the strangest areas. Needless to say, I've never supervised in gynecology before. Needless to say, but the wonderful Cameron was so powerful, and it was such a lovely combination. I got to meet a new supervisor as well and work with him, and he was superb. But I suppose what the three of us did is the three of us held hands, yes, and we cared for a woman-centric medicine. We cared, it became almost, a feminist sociology, some of the contextual statement as well. So it was the weirdest. So the sort of the feminist sociology came in with gynecology, and the result was just stunning. But Fariba darling, I'll always cherish these wonderful Sunday mornings. So in my head, we sort of shared it, to be honest with you. I'd get this work delivered on Saturday night, and Sunday morning I'd go to the gym, I'd come back, I'd get myself a pot of coffee, and it was Fariba time. And I would sit for 3 hours and go through the chapter, go through how we're organising the articles, and I could see how quickly this was progressing. So I probably destroyed your life during those 2.5 months, 3 months, but it was a pleasure for me, absolute pleasure.
You're wonderful. Thank you. Thank
you. Well, and of course, we're reaching the end of our conversation today, and obviously the thesis is completed. Remarkable results from international scholars. This wasn't sort of like, Dyler made an Australian examiner. These were international, profoundly international examiners working in this field. But what would you recommend to the students that will follow you, Fariba? Because obviously the PPP, the PhD by prior publication, is starting to lift in the proportionality of the doctorate, but particularly for professionals out there. They may be from medicine, they may be from law, they may be from urban planning, colleagues around the world. What advice would you give them about this mode of doctorate?
I believe PhD by prior publication is a great idea. And I don't think that it is promoted enough. So it has to be really a lot more work done on promoting it, because it was just a coincidence that I came across it. So, and it is a shame. Many people are doing great research. They have wonderful stories to tell, but they don't have time, or they should not take time off because they are so important in their jobs and in their field to become a traditional PhD student for 3-4 years. So it can give them an opportunity to do their research alongside their whatever work they do. If they are doctors, they do the doctor work. If they are lecturers, they do whatever. So without stopping their career, they also could do this. And, I came across this a bit late in my career, but if I knew that about 10, 12, 15 years ago, I would have paced myself properly. I would have organized myself properly, and I would have achieved this result maybe earlier. What I would say to the students, if you have a story and if you have innovative mind, PhD is a great way to go, PhD by prior publication. And don't give up, be determined. And there will be always someone who will supervise you, and you will always find time to do it. And as I have done, I'm very busy, and I'm a mother, I am a daughter, I am a wife, I am a friend, and I managed to do it. If I manage to do it, anybody can. So you just I need to want to do it. So if there is a will, there is a way.
And see, that's the bravery too, though, Fariba, because if you are profoundly successful, see, this is the other point, you are a profoundly successful person. And there is something that's risky, I think, if you have a go at a PhD from success. Like, you know, if you're 22 and life is just starting and you're having a go, I think a PhD is a bit different. But I think if you've actually led a successful big life, which you have, you're putting a little bit of yourself at risk. And so that's your bravery, which leads to my final question. And I must not get emotional about this, but Fariba, what does the PhD mean to you and for you?
It is a great deal to me. It serves as a second level of endorsement of my innovative work.
Oh, wow.
The practice that I have. Because my research was controversial and at time it caused me a lot of heartache. So a lot of comments and criticism, I knew that it came from ignorance rather than from being vicious. So it was good for me to say that there are colleagues internationally that recognize the work that I am doing. And hopefully one day one person can, or many people can take it to the next level and make it even better. So it was good. The recognition was good, as I said, second level of endorsement. And it will also give me opportunity to supervise my medical students.
Indeed.
I do. And the fellow training, I am an ages supervisor and they have to do research while they do their training. And it gives me more skills now. My mindset is different after having done this PhD. The way you mentored me, I have learned a lot of skills in terms of mentorship. I have learned a lot of mentorship skills from Cameron.
Indeed.
So I am a different mentor for my students. So that gives me the skills to do it. And also coming from Middle East, I am hoping one day I can do charity work in Middle Eastern countries. And having a PhD it gives you a voice and gives you a bit more credibility among men when we work with them. So I think that's something that I wanted to have as well. So basically PhD is the foundation of the legacy I wanted to leave behind. And it gives me, how do I say that? It brings all the papers together, the threads of the papers together and makes it in a philosophy of minimally invasive care for women.
Look, what a profound answer. And of course, can you imagine how fantastic this woman is and will continue to be as a PhD supervisor now? So that's stunning. And also, as Fariba and I talked about before we started recording this vlog, the contextual statement, which is a long piece of work in a PhD by prior publication, can now become almost a standalone short book for Fariba, which is what I'm hoping it will be, about women, about minimally invasive surgery, and about the future of women's bodies and women's health. And I think the contextual statement is so rich and so powerful that I think if Fariba adds literally 5,000 more words to it, that it's a standalone book for Springer Health that I think will change lives. So ironically, a PhD by prior publication has then provided the strategy for the next publication, which is Fariba's book. So Fariba, I can't express to you how much I respect you, how much it's been a privilege to be of service to you. And, you know, one of the strangest of the supervisions I've ever done has ended up being, I think, the most meaningful to me. And it has been a privilege to know you and see your contribution to the world. And I know that in the next stage of your career, this PhD will only enhance your fabulousness and your brilliance and your profile in the areas of the world where you want it to be.
Thank you, Tara. I really want to take this opportunity and thank you and Cameron for trusting me. So for listening to me, for hearing me and understanding where I came from and giving me this opportunity, which I almost gave up until I met you. If I have written this piece of knowledge and paper and PhD is because of you. So you made it happen. I had all this information for the last 10 years, but I couldn't publish it, but you made it happen. And I want to thank you, and I want to give all that credit to you, that without your help and your assistance, I would not be where I am today.
Oh, I love you forever. You are an amazing person, and I thank you for that. I don't think I deserve that. I think you deserve every nodule of success that you gain, but it's been a privilege to be of service to you. And I hope the vlog today inspires thousands of people around the world who are doing outstanding work to have that second level of validation, as you've talked about. So Fariba, I'm glad, as I'm sort of about to leave Australia, that we've shared this moment. And as I said to you before we started, I'm not dying, I'm just moving to New Zealand. So you and I hope will have a fantastic relationship, and let's get this fantastic next book out for you and continue to change the world.
Thank you, Zara. Thank you for your time.
Thank you, my darling. On behalf of Fariba and myself, we wish you love, light, and peace. Fariba and Tara, out.